Good morning, friends. Welcome to Dr. PM Times. This is Dr. Murugesan. Friends, in this episode, I am going to allay the fears of getting insulin as an injection from your minds. I have already described in my previous video how early insulinization in a diabetic patient is very beneficial. So, we all know insulin is the best drug in the treatment of diabetes, but we are very much hesitant to take that, especially patients when they come to me, they request, sir, please give me drugs, don't give me insulin. The problem is because we are apprehensive in taking injections. Not only you, including myself, any person is apprehensive in taking injections. But with the advent of newer devices, it is very easy, comfortable, and absolutely pain-free, and there is no incidence of infections at all in taking insulin. I will explain how. So, the main problem is the fear and also the social stigma surrounding it. There should not be any social stigma in taking an injection because you are taking the best available drug which is present for managing the diabetes. Then why we should prevent it just for the fear of social stigma or just for the fear of injections? Instead, take the drug which is best suited to treat diabetes, that is insulin. Insulin, as I said, with the advent of newer devices, it is easier to take as an injection wherever you go. This is an insulin pen which has got a sterile pouch, which is kept in a sterile pouch, and this can be carried easily in anywhere, whether you are a frequent traveler, whether you are attending a conference, you are on a business trip, or you have gone away from home for studies, wherever you are, in between, even in between meetings, this pouch is very handy and sterile. It can be easily used to deliver the drug. This pouch contains the insulin pen. There is also a sterile needle, and of course there will be a leaflet inside this which will tell you how to use this pen. I will explain how to use this pen. This pen has got a pen cap. If you remove it, you can see a cartridge holder inside which the insulin cartridge has to be inserted. This is a small cylindrical glass substance or a small cylindrical structure which has to be fitted into this cartridge holder. The cartridge has got 3 ml capacity, and each ml has 100 units of insulin. So this inside this cartridge holder, the cartridge has to be fitted, and it should be fitted in such a way the metal end is in this end, and this end there should be a plunger stopper, and you fit in, and after fitting the cartridge you keep it inside the insulin pen till you get that click effect. And in the insulin pen main part or body, there is a dose adjustment pattern. There is a dose window here. There is a dose knob which you can adjust the required dose, say 8 units or 10 units, and there is an injection button also. Then you fit in the needle into the insulin pen, and the needle is a disposable needle with an outer cap which can be removed and an inner cap which should be removed at the site of injection. And the needle you see is very thin, flimsy needle of bore size just 0.23 millimeters, that is 32 gauge needle, very small needle, and length just 3 to 5 millimeters, average 4 millimeters. So when you prick, it is absolutely pain free. Then after taking the inner cap also, you choose the site of injection. The site of injections are usually the forearm, upper aspect of arm, outer aspect of arm, the lumbar regions in the abdomen, upper aspect of thigh and outer regions of thigh, and even the buttocks region with the help of others. So we have so many sites which you can rotate it. Say in the morning, your first dose you usually take after having bath, when your skin is sterile and smooth, before dressing up, where you won't forget or skip the dose. You keep the pen perpendicularly to the skin, say the forearm, and this injection button you press like a pen. Then the drug is delivered exactly in the subcutaneous plane. Leave it for 10 seconds and remove it so that drug is completely delivered into the subcutaneous plane. Then the next dose, say in the afternoon, you give in the arm. Then evening you give in the lumbar region of the abdomen. So you rotate the places so that same place is not repeated again and again. Injection is not repeated in the same site again and again. By rotation, it comes say once in 10 doses or 12 doses only. So the chances of infection, the chances of redness or chances of pain in that area is lesser. Then before putting the drug, that is the cartridge, into the cartridge holder, you take it out of the fridge before loading. You keep it in your hand like this, rotate it for 10 minutes so that the temperature is brought to room temperature. Then you hold the plunger stopper end and the metal end in the hand like this. There is a glass bead usually present inside the cartridge. You shake up and down like this for 10 minutes so that the drug mixes uniformly. It becomes an white opalescent uniform fluid. Then you insert the cartridge and then you give the injection as suggested. Then after the injection is given, it is better remove this needle or change the sterile needle after every injection. Replace it and keep it in the fridge door for optimal temperature. And next time you use, you need not load the cartridge again. Cartridge is already present. As I said, a cartridge contains 3 ml, each ml having 100 units of insulin. But shake well before giving the next injection. Then after that, you again close it, close the pen cap after removing the needle and keep it in the fridge door. So thus, by rotating the site, by appropriately delivering the injection after bringing it to room temperature, the incidence of infection, the incidence of pain, redness, etc. are less. So the patient will not be apprehensive in taking the drug again and again, and patient compliance will also be better in taking the drug. Then also you should have the knowledge that the absorption is maximum in the abdomen. It is lesser in the arm, then thigh, then buttocks. So in the descending order, the absorption is maximum in the abdomen. Next comes the arm, next comes the thigh, next comes the buttocks region. With this knowledge, safe and sterile process of delivering injection, the complications of injection delivery or the apprehension or fear about taking injection can be overcome. The patient can enjoy the benefits of this beautiful drug, insulin, which is the gold standard drug in the management of diabetes. Thank you.